So I'm Danny. I'm a pharmacist by background, do a regional role for NHS England, and I teach at the University of Brighton. I've been a pharmacist for about 12, 13 years now, and a prescriber for 7 of those years. So yeah, really keen to share the knowledge about prescribing safely and all things pharmacy, really.
So my name's Matt Dixon. I'm a paramedic. I've been a paramedic since 2011 now. I've worked in clinical practice, in education. For the last 8 years, I've been an advanced practitioner in general practice primarily, as well as continuing to work semi-regularly for the ambulance service.
So we aimed this book allied health professionals of all creeds and all experience, really. I think it's really useful, perhaps when you're bogged down in one condition and you need to refresh your learning in another condition that perhaps you haven't seen in a while, that actually this book can be useful for either the newly qualified prescribers or the experienced prescribers that need to delve back into a body system that they're perhaps not as familiar with.
This book covers an introduction to the law as it applies to prescribing, the use of medication in certain circumstances where a prescription's not needed, so patient group directions, emergencies, for example. Following that, there's a fairly useful introduction to pharmacology, which is an important thing to understand when it comes to anything which involves the use of medications, really. Following this, there's a section of chapters on common medications that are used in general practice, broken down by the relevant body system, cardiology, high blood pressure management, so on and so forth. And finally, finishing with a quick reference guide on the management of a selection of emergency presentations in primary care, generally those which involve the use of a medication of some sort to treat.
So this book that I co-authored really was just to be a bit of a how-to guide, going through the different body systems for prescribers and allied health professionals that perhaps aren't familiar with all of the different body systems and how to prescribe. And we wanted to make it as useful a guide as possible for people to relate to it when they're in practice and they're really busy seeing patients day to day.
I was inspired because when I was new to general practice, the amount of information that I had to take in was really quite significant. It was a very steep learning curve, and finding the right resources at the right level was a bit of a challenge. That spoke to me as a bit of a gap in the market and somewhere that potentially a single text could have some positive impact on.
I think the hope from myself and Matt is that this should be a staple in the allied health professionals kind of bookshelf, in terms of what they need in terms of resources when they're thinking about prescribing in primary care. I would hope that this book would be a really useful kind of must-have, particularly for those allied health professionals that are really busy in primary care, that need something to put their hands on just quickly when they're in clinic or when they're reflecting on their CPD after a busy day. I think this book's really useful for both of those kind of indications. 3 words to describe the book. I'd say useful, relatable as well. It's not completely ethereal and just really highbrow pharmacological knowledge. I think it's really relatable to everyday practice and needed as well. I feel like this type of book doesn't exist in the ecosystem at the moment, so just a needed publication for those professionals in primary care.